Hey there, it's Huang. One very common question I get as an occupational therapist and certified hand therapist is, Huang, how are you protecting your hands as an occupational therapist? I had one person send me a message that says, I've been working as an occupational therapist for 3 years and my hands are always in pain. Like, what are you doing? Well, my name is Huang. Like I said, I'm an occupational therapist and certified hand therapist. And I've been in practice and clinical practice for over 20 years. Now, how did I do that by and not have any hand pain? Well, I'm going to share those secrets with me so that you too can save your hands. I think one thing that I hear often of therapists who want to move away from their current setting, moving into hand therapy, is like it's easier, right? It's easier for your back. I've done skilled nursing, I've done home health, I've done acute care. Majority of my experiences in acute care, and I was recently reminded of how heavy that really is. You are getting people in and out of bed who, can't get up, who are sick, and you're managing lines, you're managing all sorts of stuff, and it can be really tough on your back. Well, when you're in hand therapy, majority of the time, you're working with people who are really stiff, right? You're working with stiff hands, and the smaller their finger is, like if you're working with a thumb, it's almost better than if you're working with like a small finger. It can be so straining onto your hands because you have to work like this, trying to move them, and it's like patient after patient after patient, and you go home at the end of the day with hand pain, with thumb pain, with tingling, with numbness in your hands, with fatigue. I mean, all sorts of stuff. I've heard it time and time again from so many occupational therapists. I hear from physical therapists too, who are doing a lot of manual therapy and then having pain. So I'm going to share with you, these are 3 things that I do. These are my main 3 things, and I go back to them time and time again. If I ever am like, why do I feel this? This is exactly what I do. Number 1, I'm always making sure that I don't have pain. As soon as I feel it, I really work to take care of it, right? Number 1, you've got to take care of your body. So your hands will be stronger if your shoulders are stronger, right? If your biceps, your triceps, your elbow muscles, your forearm muscles, if all those muscles are stronger, then your hands will be stronger. So number 1 is that I do a certain amount of exercises. I don't do like a ton. I'm not like a gym buff. I mean, I am going to the gym now more just because I'm getting older and I'm thinking about longevity in my career. And I'm like, okay, I don't want to get to a point in my career where I want to retire and like everything hurts, right? Like that's just not how I want to live my life. So I do things to protect my hands. First and foremost, I make sure I exercise. If I am giving my patients an exercise, I need to know how it feels on me. So I get my exercise in when I'm demonstrating for them. When they're doing an exercise, I will do it with them so that I'm like, oh, if I'm working on internal and external rotation, for sure I'm doing some of those. If they are working on shoulder extension, I'm working on shoulder extension too. Things like that. I will work on my hips and my back while they're doing stuff. So it looks like we're exercising together. So I get it in when I can. That's number 1, protect my own body first. Number 2 is I'm a really big fan of managing my body mechanics, right? And this is so embedded in my manual therapy workshops, and I show people how to work with patients in different positions. So now, generally speaking, and I'm going to say generally speaking, you'll see a hand therapist on one side of the table and you'll see the patient on the other side of the table. I don't think that works that well. First of all, I'm not a very tall person. I'm kind of short. I'm 5'1", and that's stretching it. I have good length arms, like I'm proportional, but my arms can only go so long, and your patients come at different heights, different sizes, and your hands are a different size from my hands. And so when I teach within my manual therapy workshop, I go over those body mechanics, like things like fundamental things that you have to take into consideration. I'll give you an example. I don't always like to work in front of a person. If I have to work their whole arm, I will sit next to them instead. I will put them on a mat instead. Now I know some people are like, well, I don't have the space, you know. You should ask for the space because in most therapy clinics there's mats and other people don't need to hoard them all, right? I remember moving from my outpatient setting to another clinic's outpatient setting, and they literally were putting baby in the corner. You know what I mean? Like I had this like little hallway, and it had a long table where all my patients could sit. I'm like, thank you, but no, thank you. I need a mat, and I was not going to manage 3 patients, 4 patients at a time on one mat and then run across the room to get to a mat. I was like, you guys need to rearrange this, and I need that mat right next to me. The PT, who can only see so many patients at a time, had like 5 mats for him. I was like, yeah, people can move the equipment and give me a mat right next to me. And I think part of it is like, you just have to ask. If they say no, they say no, but then you have to ask. And I mean, I didn't ask in that way. Like, obviously, I'm telling the story, but I asked very nicely. I was like, in order for me to do what you want me to do and get results for patients and have them keep coming back because they're really happy with how I'm treating them, I need this mat next to me. You know, like you can say it in a nice way. You can say it in a way that can get you what you want. And so I'm telling a story, but I'm not that harsh. Um, so body mechanics is really, it's really huge for me. Yes, it's extremely important. We should celebrate it. So I think of not only, working in front, I'll think of patients' different positions. And then the other example of good body mechanics is managing, managing my own body based on what I need to do. So, for example, if I am working on a really stiff elbow, I'm not working at the table. I need them on a mat because it's going to be so much easier for me. And I want to use my whole body. Like I'm going to use my whole arm versus just, you know, using my hands. Let me know if that makes sense. You can leave a comment below if any of this helps or if this really makes sense to you. Because I think that for us therapists, like we really do have to think about our own bodies and longevity. And so body mechanics is a really important aspect. If you have, any follow-up questions from it, just leave me a comment below. But yeah, I want to use my whole body, and your leg muscles and your body weight can be really helpful when you're working with someone who's really stiff, and that way you protect your hands, right? So number 1 is I exercise and keep my body pain-free. Number 2 is I manage and I focus on body mechanics when I'm working with someone. And then number 3, I think one of the most important things that you could do to protect your hands as an occupational therapist or a hand therapist is that you have to use proper manual techniques. So the way I see it is manual techniques is paired up very closely with body mechanics. One thing that I notice quite a bit when I'm teaching my manual therapy workshops is people have a tendency to use their thumbs very specifically, like where they pinch like this. So if they pinch like this, then you'll see their muscles are really strained. But I think that there are ways in which you can pinch and either use different aspects, and it depends, of course, on your own mobility. But I always say, like, you actually need to have the tips of your fingers much softer than you think, right? So the technique itself, if you're overworking, like if your hands are squeezing the hell out of somebody and you have pain later, you are not demonstrating good manual techniques, because it at the end of the day shouldn't hurt you, right? And then in terms of manual techniques, knowing how and when to take breaks by switching your techniques is a really important concept to protecting your hands. So, for example, one of the easiest example that I could share with you is when you're working with a stiff finger, right? One of the most important exercises we could do is blocking, right? But what happens is we tend to squeeze so much that to stop the blocking, right? To stop the blocking. So from a manual perspective, right? From a manual perspective, and I'm going to exaggerate this just so you can see it, right? If you're blocking them from MP, PIP, and you want them DIP, but they're so strong, they're we're doing it because they don't have the full motion. Let's say they're stuck like this, right? And you're trying to get them to block, and you're trying to go in an extension, but also allow them to block, right? What I've noticed people tend to do is squeeze the whole time. So when the person blocks, they're squeezing and they're constantly squeezing, right? One thing you can do is work with them very rhythmically and say, I'm going to hold you like this, right? And you're going to squeeze to get the extension. And then when they come up, you relax your hand a little bit. And then when they go into block, you hold it. And then when they go into extension, you let go of it. Now, obviously, I'm exaggerating that movement. You actually don't let go. You hold it, but you're not squeezing, right? You're going to hold to maintain, but you're not really squeezing, right? So that there's like this ebb and flow to your technique so that you're not constantly contracting. The other thing in terms of the technique aspect is if we're asking someone to do something, we need to give proper direction so that they do it correctly, so it's not harmful to us. So when I'm telling someone to do a blocking exercise and I tell them, I'm going to hold you straight at your big knuckle and at your middle knuckle, and all I want you to do is pull down at your little knuckle. When people are injured, they try really hard and they engage all of the muscles. Let me know if that happens to you, because that surely always happens to me, especially when they're stiff, right? So in that example, I'm going to hold and then I'm going to explain to them, okay, so I just want you to pull gently. So only this one. So one thing I'll do is I'll ask them to demonstrate. I'll demonstrate it with their other finger. And then I teach them how to gently pull in that one specific tendon that I'm looking to improve upon without them pulling on everything and pulling on the PIP as well, because then you're working super hard to do this one manual stretch with exercise. Let me know if that makes sense. So your directionality around what you're doing paired with that manual technique needs to work. You're right. Like it comes down to a little bit technical skills. It's just managing some of that will also help protect your hands. I've trained so many therapists who have come through my clinic, and one of my most important thing, as I tell them, is if your hands are hurting at the end of the week or so, like you're doing it wrong, right? And so if I've had students come through and it's like, oh, the first week they're like, oh my God, my hands. I'm like, you're doing it wrong. And by the end of the 3 months, they should be much better and they shouldn't have that kind of hand pain, because then it tells me that they're not demonstrating the proper manual techniques because they're trying too hard. Or I might have to encourage them to exercise a little bit so that they not only can feel what the patients are supposed to do, so they know how to better give the direction, but also it helps them over time to not get injured. And that's really important. I've trained students, I've had therapists come through my clinic, I've had therapists come through my manual therapy classes and things like that. And really, one of the biggest questions is, how do you protect your hands? And I think if I were to bundle it up into those 3 major concepts, that's it. You've got to stay healthy and strong for yourself. You've got to, so that you can help other people, because you can't help anyone if you're broken. You can't help anyone if you're broken and you think therapy doesn't work, because you're going to admit that. If you're like, oh, well, nobody buys into therapy. I'm like, do you buy into therapy? All right. First question to ask therapists, do you buy into therapy? Do you know that this works? Because if you have pain and you can't get rid of it, there's no way you can tell other people that it's possible for them to get rid of it, right? Therapy freaking works. It's just got to be done right, right? So do therapy to yourself, for yourself, so that you can be pain free. Two is really pay attention to your body mechanics. It's huge. It's not just for heavy lifting, it's for anything that's heavy, repetitive, that you do over and over again, right? Uh, when you do it and you demonstrate it, your patients also see it and they are like, oh, wow, like I got to pay attention to that too. It's both for you and a teaching moment for them. And then number three is using proper manual therapy techniques will save your hands each and every single time, right? Each and every single time. I hope this video helps you because I do want to share it with more occupational therapists, physical therapists as well, who are working in hands, because hands is a different type of toughness. You know, it might not be as heavy as like lifting a whole leg or lifting a whole body, but it can be really hard on your body. So I hope that this video helps you. And if videos like this help you, go ahead and like, subscribe, and share with another friend to see if you can help them as well. Protect their hands. All right. Now, if you're looking to learn more manual therapy, if you're looking to learn more therapy, manual therapy techniques, I've got some other videos on my channel as well. So I'm going to see if I can link it here and you go check it out. All right. Until next time. See ya.